Hello, hello. All right, today we are still answering some of the Dr. Sammy questions. Thank you for posting those guys when they asked for them. And one of the questions is, I believe from Facebook, I don't remember, Facebook, Instagram, wherever, is my dog is allergic to something in my backyard. What else can we do? They went to a clinic and they got some medication for the hives on the patient and go from there. And I believe in their posts they said now it happens once a month for the last few months, and that's really all the history that I have. So, not a lot you can do. If we're having a contact allergy or something specifically in your backyard, really only two main things you can do is move or completely change the landscape in the backyard. I cannot change you from being allergic and not allergic to something. If you are allergic to bees, I can't change that regardless what medication I give you. You are still allergic to bees. If you're allergic to peanuts, don't eat peanuts. A little bit harder when it's an environmental thing, especially if we don't know exactly what it is. Is it the dirt? Is it the grass? Is it something in the grass, something in the dirt? Is it a pollen in the neighbor's tree? Is it, a stray cat that comes by every now and then and poops in the yard and the patient eats it? I don't know. Some of those we just never really get a straight answer to. Wish I could give you a little better answer with that. But some of the things you can do that I have had work for some patients are, if you know it's in the backyard, moving is unrealistic, redoing the landscape or blocking off the area that the patient is allergic to, if you even know what area of the yard the patient is allergic to, is unrealistic or unfeasible financially. Something you can do is let them out. When they come back in, go ahead and take baby wipes or something like that and clean the areas that are having the reaction. Typically it's paw pads. If it's the belly, go ahead and just wipe the belly down. So basically you're just trying to remove the antigen, therefore the body does not react to it. I've had that work for a few clients, a few patients. It just depends what they're allergic to. We have a lot of military here in El Paso, Texas, and we see this question all the time. El Paso has terrible allergies, particularly this last year. They have been horrendous. They have been horrible. And when clients will move from El Paso to, let's say, where'd somebody go recently? Washington. They moved from El Paso to Washington and their allergies dramatically improved. Well, they have different pollens, different trees, different grasses, different things that the patients are responding to. And it usually takes them about a year to be exposed to all the seasons, and then the next time the body sees those antigens, those pollens, the body will now know, I don't like you, I'm gonna react, and then you have a reaction or allergic, hives, whatever. We also see the reverse of that. I've had a bunch of clients move from Mississippi or Georgia, Florida, and they move to El Paso and their allergies dramatically improve. Once again, short of moving, and sometimes moving cities, states, that's not really realistic for most people to do that for their pet alone. And if it's an environmental allergy, the only thing you can do is change the environment. The only way you do that is you move, or try and minimize the exposure if possible. But sometimes that's hard to do if you don't even know what they're actually allergic to. There is an allergy blood test. The specialist in the school where I was trained with was not a big fan of it and did not like it. They did not believe it was very specific and very accurate, and it missed a lot of things. I believe dermatology specialists, what they do in pets is the same thing they do in people. They will have a regional one where they will shave the back of the patient. People, they typically don't have to shave their back unless you're a really hairy person. Then they might shave a little bit. But they have different sets of 20, 40, and sometimes I think 60 different antigens for this grass, this grass, this grass, this tree, cottonwood trees, mesquite trees, juniper trees, mulberry trees, whatever, whatever's in their area. And they will literally dip it in that allergen with a needle, stab a hole in your back, and then go to the next one, rinse, repeat. So they literally stab you about 20, 40, 60, 80 times, however many allergies are on that panel. And then they wait and look for a reaction. And then once they figure out what they're allergic to, they will send those results to a lab. They will specially formulate that cocktail, and you will have a patient-specific vial of anti-allergen that you have to be on a protocol for an extended period of time, typically a couple of years. The frequency changes depending on what stage you are at, and that can change the immunity to the environment. It's not cheap, and there are very few people that do it outside of the specialists. So here in El Paso, we don't really have a dermatology specialist, so it's not realistic for most clients in my area. But it is an option that exists and is at least out there just so that you're aware of it. And that is the absolute best one that I'm aware of. It's just very aggressive, and it takes a lot of time, money, and it's a gradual improvement, not a, I give you a shot and I'm done, I'm over it. That does work sometimes, but not for ever. So hope that helps you a little bit. Wish I could give you a more straightforward, realistic option. There are some options, but some of those, like I said, unless you're in the military and they're moving you around, or your job moves you every few years out of the state, not even the city, sometimes there's nothing you can really do for it, and just deal with the clinical signs as they happen. Hope that's helpful, guys. We'll see you later. Bye.